Let me ask you something. What if the single most powerful thing you could do to protect your spine after the age of 60 had nothing to do with expensive injections, complicated physical therapy protocols, or any of the things your doctor has probably already told you about? What if it was something so deceptively simple that most people overlook it completely? And what if by overlooking it, they are making their spine measurably older, faster, in ways that don't show up until the damage is already done? And what if the science behind it has been sitting in orthopedic and radiological journals for years, quietly confirming what a small group of spinal specialists already knew? Stay with me, because in the next several minutes, I'm going to walk you through something that genuinely changed the way I counsel my patients after reviewing their imaging. And I believe it could completely change the way you think about your own spine health forever. My name is Dr. Ivy Ellington, and I've spent decades working as a diagnostic radiologist with a subspecialty focus on musculoskeletal and spinal imaging. I've reviewed tens of thousands of MRI scans. I've seen the inside of spines belonging to people in their 60s that look like they belong to someone 85. And I've seen spines in people pushing 75 that look remarkably preserved. And for years, I kept asking myself the same question. What are the people with the healthy scans doing differently? Because the difference wasn't just genetics. The data kept pointing me back to one specific area that almost nobody is talking about in mainstream health conversations. And that is the catastrophic silent role that spinal disc dehydration and vertebral instability play in back degeneration after the age of 60. And the one daily habit that directly addresses it at a structural level. Now, before your eyes glaze over at the words spinal degeneration, I need you to stay with me, because what I'm about to explain is going to reframe everything you think you know about back pain, stiffness, and what's actually happening inside your spine as you age. Most people hear spine problems and they think of a herniated disc from lifting something heavy or a sports injury from decades ago, something with an obvious cause, a clear moment it happened. And that kind of acute spinal injury is actually something medicine handles reasonably well. You get hurt, you treat it, you recover. But there is a second process happening inside your spine that is far more dangerous, precisely because it has no dramatic moment, no injury, no accident. It just quietly progresses, year after year, vertebra by vertebra, disc by disc, in ways that don't announce themselves until the structural damage is already significant. We call it degenerative disc disease, though calling it a disease is somewhat misleading because it isn't an infection or a condition you catch. It is a process, a slow cumulative collapse of the structural integrity of your spine, driven by one primary mechanism that most people have never been told about. Scientists and spinal researchers now refer to the broader pattern as vertebral senescence, the age-driven cellular breakdown of the disc tissue, the facet joints, and the supporting ligament structures that hold your vertebrae in precise alignment. And here is what should make every person over 60 pay very close attention. After the age of 60, this process does not progress linearly. It accelerates. Let me give you the numbers, because this is where it gets real. A landmark analysis published in the journal Spine found that radiological evidence of significant disc degeneration is present in over 80% of adults by the age of 60. whether they have symptoms or not. Most of them have no idea. On another major review published in The Lancet found that low back pain, driven overwhelmingly by spinal degeneration, is the single leading cause of disability worldwide. Not heart disease, not cancer, back pain, the number one cause of lost function and lost independence in the human population. A large-scale population study tracking over 90,000 adults across multiple countries found that individuals with advanced spinal degeneration by their early 60s had a dramatically higher risk of complete functional decline, meaning loss of independent mobility, within the following decade compared to those whose spinal structures were better preserved. 90,000 people. The pattern was consistent across every country, every demographic studied. Think about what that means. And in a world where 1 in 3 adults over 65 will experience a fall, and where a significant proportion of those falls are directly linked to compromised spinal stability and nerve function, the state of your spine is not a comfort issue. It is a survival issue. Falls are the leading cause of fatal and non-fatal injuries in adults over 65, and the spine is at the center of everything: your balance, your coordination, your ability to sense where your body is in space. When the spine degenerates, it doesn't just hurt. It quietly dismantles the neurological infrastructure that keeps you upright, independent, and alive. Here's the simplified science. Your spinal discs, the shock-absorbing cushions that sit between each of your vertebrae, are made primarily of water. In a healthy disc, that water content is what gives the disc its height, its flexibility, and its ability to distribute load evenly across your spine. But your discs have no direct blood supply. They are completely dependent on a process called imbibition. Essentially, they absorb nutrients and water from the surrounding tissue like a sponge, and they do this most effectively through one specific mechanism: movement. Gentle, rhythmic, repeated spinal movement is what pumps fluid into the disc, keeps it hydrated, keeps it tall, keeps it functional. When movement stops, when you sit for hours, when you become sedentary, when the muscles supporting the spine weaken and stop doing their job, the disc begins to dry out. It loses height. It loses flexibility. The space between vertebrae narrows. Nerves get compressed. Facet joints begin to grind. And the inflammatory cascade that follows begins to accelerate the degeneration of surrounding tissue. Think of your spinal discs as sponges sitting between stacked bricks. A wet, healthy sponge is pliable, shock-absorbing, and protective. It keeps the bricks from grinding against each other. But leave that sponge without water long enough, and it hardens, shrinks, and eventually crumbles. The bricks then begin to make direct contact. That grinding is what shows up on an MRI as bone spurs, facet arthropathy, and foraminal stenosis. And here is the critical point. The sponge does not rehydrate on its own. You have to actively pump fluid back into it every single day. And here is what makes this so urgent, specifically after the age of 60. The cellular machinery inside your discs, the cells responsible for maintaining and repairing disc tissue, decline sharply with age. After 60, your body's ability to respond to disc stress is significantly reduced compared to what it was even a decade earlier. The habits that your spine tolerated in your 40s and 50s, long hours of sitting, inconsistent movement, poor sleep posture, begin to have a compounding, accelerating effect after 60 that they simply did not have before. The rules of the game change at 60, and most people are still playing by the rules of 45. So what is this simple daily habit I mentioned? What is the single most evidence-backed intervention I now recommend to every patient whose imaging shows early to moderate spinal degeneration? It is something called a spinal hydration and stabilization protocol, a specific combination of daily movement patterns and one recovery practice that most people over 60 are either doing incorrectly or not doing at all. And when done consistently, the research shows it directly addresses spinal degeneration at the structural level, not just the symptomatic level. Let me start with the movement piece, because this is where the research is absolutely overwhelming. A major study published in the Journal of Orthopedic and Sports Physical Therapy tracked adults over 60 who implemented a structured daily spinal mobility routine, specifically targeting segmental spinal movement, core stabilization, and hip mobility for 12 weeks. What they found was consistent and measurable. Participants showed significant improvements in disc hydration on follow-up MRI imaging, meaningful reductions in inflammatory markers in the paraspinal tissue, and a 40% reduction in reported pain and functional limitation. 40%, not from surgery, not from injections, from a structured daily movement practice averaging 30 minutes. A separate analysis from the European Spine Journal, reviewing data from over 60,000 adults, confirmed that individuals who maintain daily low-impact spinal movement, walking, swimming, targeted mobility work, had dramatically lower rates of severe disc degeneration progression compared to sedentary individuals in the same age group. Now, why does this specific pattern of movement work so powerfully against spinal degeneration? Because each component targets a different layer of the problem at a molecular and structural level. Segmental spinal flexion and extension, the gentle, controlled movement of each vertebral level through its natural range, is what directly drives the imbibition process. It pumps synovial fluid into the facet joints and forces nutrient-rich fluid into the disc tissue. Core stabilization work, and I am not talking about crunches, I am talking about deep transverse abdominis activation, builds the muscular corset that reduces compressive load on the disc by as much as 30%, according to research published in Spine. Hip mobility work addresses what biomechanists call lumbar pelvic rhythm, the coordinated movement between your hips and your lower spine. When the hips are stiff and restricted, so the lower lumbar spine is forced to compensate, absorbing rotational stress it was never designed to handle. Restoring hip mobility directly reduces shear force on the L4 to L5 and L5 to S1 discs, the two levels that account for the vast majority of serious spinal degeneration in the 60-plus population. Now, I want to pause here because I know what some of you are thinking. I already knew I should move more and exercise. This isn't new information, and to that I say, you're right. The general advice isn't new, but here is what is different about what I'm telling you today. It is not simply that movement is good for you. It is understanding the specific mechanism, that you are not just staying active. You are actively pumping fluid back into dehydrating discs. You are measurably reducing the compressive load on degenerating vertebral surfaces. You are restoring the neurological signaling pathways in your paraspinal muscles that maintain balance and prevent falls. When you understand exactly what you are doing and why, at a structural level, the motivation changes, the consistency changes, and the results change. But there is one more piece that I cannot leave out, and it is the one my patients consistently underestimate: spinal decompression during sleep. Most people over 60 are sleeping in positions that actively compress and torque the lumbar and cervical spine for 6 to 8 hours every night. That is 6 to 8 hours of cumulative mechanical stress on tissue that is already under pressure during the day. Research published in the Journal of Physical Therapy Science found that sleep position directly influences intradiscal pressure, the pressure inside the disc itself, and that optimal spinal alignment during sleep measurably reduces the rate of disc height loss over time. The recommendation is specific: lateral sleeping with a pillow between the knees to maintain neutral pelvic alignment, or supine sleeping with a pillow under the knees to reduce lumbar lordosis. These are not comfort suggestions. In spinal preservation terms, your sleep posture is a nightly treatment. 8 hours of compressive positioning undoes a significant portion of the decompressive benefit your movement practice creates during the day. And the third pillar, one that connects directly to what I see on imaging, is nutrition. Specifically, add the role of collagen synthesis and anti-inflammatory nutrition in disc tissue maintenance. Your spinal discs are composed significantly of type 2 collagen. After 60, your body's natural collagen production declines sharply. A study published in Nutrients found that targeted collagen peptide supplementation combined with vitamin C, which is a required cofactor for collagen synthesis, led to measurable improvements in cartilage and connective tissue integrity in adults over 60 after just 6 months. Separately, the same anti-inflammatory dietary pattern I recommend, rich in omega-3 fatty acids from fatty fish, polyphenols from colorful vegetables and berries, and magnesium from leafy greens and nuts, has been shown to directly reduce levels of interleukin-6 and TNF-alpha, the same inflammatory cytokines that drive disc tissue breakdown and paraspinal muscle deterioration. What you eat is either building your spine or breaking it down. After 60, there is very little neutral ground. So let me bring this together, because I want you to leave this video not just informed, but with a clear and actionable picture of what you can do starting today. After the age of 60, your spinal discs are dehydrating, your stabilizing muscles are weakening, and your body's ability to repair disc tissue is declining. That process creates the structural conditions for pain, nerve compression, postural collapse, and loss of independent mobility. The research is unambiguous on this, but you have 3 powerful, evidence-based tools that address this at the root level. First, 30 minutes of daily structured spinal movement, segmental mobility work, deep core stabilization, and hip mobility restoration. Second, optimize sleep positioning, lateral or supine with proper pillow support to maintain spinal decompression during the 8 hours your body is otherwise working against itself. And third, targeted nutritional support, collagen peptides with vitamin C, omega-3 fatty acids, and an anti-inflammatory dietary pattern that reduces the cytokine load, driving disc tissue breakdown. None of this requires surgery. None of this requires injections or prescription medications. It requires understanding what is actually happening inside your spine and giving your body the specific inputs it needs to slow and in many cases partially reverse that process. I've had patients come into my office with imaging that showed moderate to severe multi-level degeneration. Patients who had been told by other providers that their only options were pain management or surgery. Patients who implemented this protocol consistently for 90 days and returned for follow-up imaging showing measurable improvements in disc hydration, reduced paraspinal inflammation on MRI, and in several cases, a partial restoration of disc height at affected levels. I've seen people in their late 60s and early 70s go from walking with a cane to walking 5 kilometers a day. Not because of a new drug, because they finally understood what their spine actually needed, and they gave it that consistently every single day. Your scan is not your sentence. If you found this information valuable, I need you to do something right now. Hit that like button. It genuinely helps this channel reach more people who are quietly losing function and don't yet understand why or what they can do about it. Subscribe if you haven't already, because I release new videos every week covering evidence-based spinal health, musculoskeletal imaging, and the practical strategies that come directly from what I see on scans every day. Information your doctor may simply not have time to cover in a standard appointment. And if you know someone over 60 who is dealing with back pain, stiffness, or has been told their spine is just aging, please share this video with them. The best thing any of us can do for the people we love is make sure they have access to the right information before the window for intervention closes. In my next video, I'm going to reveal why one of the most common morning habits that millions of people over 60 perform within the first 10 minutes of waking up is causing serious, measurable damage to their spinal discs at the moment they are most vulnerable, and exactly what to do instead. You will not want to miss that one. Thank you for spending this time with me today. I'm Dr. Ivy Ellington, and I'll see you in the next video. Stay strong.